Welcome back, everybody. My name is Carly Sage. I'm a functional integrative holistic health practitioner and from Sage Health. And then I also own Block 134 in downtown Putnam, Connecticut. It's an arts and wellness center, and we have multiple practitioners there that people can access. And I have with me today, returning, Dr. Irene Catania, and she is a naturopathic doctor, an acupuncturist, and a homeopathic practitioner. And she practices homeopathy as part of her naturopathic medical practice. She's classically trained in what's called constitutional homeopathy. So, first, can you tell us what kind of training a homeopath receives and how you came to study this in the first place? I know you have a diverse background, so I love hearing your story.
Thank you. First, I want to thank you again for your support and my work at Block 134. It's been going beautifully. Patients love this space. They always compliment on how comfortable they feel being there. So
Thank you
thank
for
you.
that. I love it.
So homeopathy, it's a 200-year-old system of medicine. And I began studying it before I became a naturopathic physician. I took my first homeopathic first aid course, which is a simplistic course on how to treat yourself and your family in acute conditions. And then later on, I studied with the constitutional homeopath, world-renowned Dr. Murphy. Um, and then with naturopathic medical school, it's part of our curriculum. So it's not part of the curriculum in conventional medicine because it's not recognized. So I took all the courses there. We did have to practice it in the clinic, but also I went on to study with world-renowned homeopaths in courses outside of my medical training. We would all say you never finish your learning, so probably that practice it in the clinic. And I saw the results. I saw that this was a powerful system of medicine, and it had to be something that I could offer uh, to my patients.
Mm, yeah. I think a lot of people would be surprised to learn how it's not new, how you said it's 200 years old, and why don't more people know about this is my question. So can you give us an overview of what this system of medicine entails, really, a little bit more about its history so people have that foundational understanding about it?
Yeah, so the history is kind of buried in our history, like a lot of things in our history is buried. Up until the 1920s, when a doctor went to medical school, they became an MD, but they chose either the homeopathy track or allopathic. So allopathic was using drugs, allo against antibiotics, antidepressants. Homeopathy is based on the principle of like cures like. Up until that time, homeopathy was actually used on the battlefield in the US. It's in our National Library of Medicine, part of the history. During the infectious epidemics here, it actually was more effective than drugs at the time. There wasn't very many drugs. There was homeopathic hospitals, so someone could go into the hospital and choose that form of medicine. Unfortunately, with the politics of medicine, homeopathy was basically discredited through various means. The Flexner Report of 1910, which raided schools with the goal of getting rid of 50% of the medical schools. Of course, at that time, the standards were not good. They needed to be changed. But interestingly, the homeopaths scored much higher on their medical exams, even though that was the system that was destroyed as not being scientific. Um, and they were evaluated, the schools were evaluated based upon how many full-time practitioners or professors they had, and the extent of their library. So things changed. However, there was a comeback, I don't know, probably in the 1970s with the naturopathic medical schools, which became accredited to licensed physicians that were teaching homeopathy. In other countries, homeopathy is recognized and respected. When I was in Germany, every pharmacist was trained in homeopathy. You could walk into a pharmacy and get remedies. In India, there's over 100 homeopathic medical. South America, I saw many patients from these cultures who were used to homeopathy, had experienced it, and that's what they were looking for.
Hmm.
I think I missed part of your question.
Oh, more just wondering about the history, what this type of medical system entails. So, I mean, that was fascinating just to hear about um, the credibility that we once gave it and how that changed. I think if you mention homeopathy to most people in mainstream culture today, they either don't know what it is, or because they don't know what it is, they would be very dismissive of it. So obviously at one point in this country and in other countries all over the world, that's just not the case. So that's fascinating. But yeah.
Exactly. Even today, if you were to research homeopathy, you'll see a lot of reports disproving it. Um, More recently, there's been some studies. I referenced NIH doing double-blind placebo studies where they said, okay, people who took homeopathy did better than placebo.
Mm,
So there are studies out there. The
mm,
difficulty with the studies is because homeopathy is so individualized. It's not like you give the same remedy to everybody with the same condition. So it's hard to study. Because when we look at the totality of the person, we're not just looking at their physical symptoms, but looking at who is that person, what are the psychological, what are the emotional, um, who are they in this world?
mm,
What makes them unique or different? So it's very hard to study, although studies have been done. Basically, homeopathy, the premise of like cures like, is that any substance in its pure form, which may cause symptoms in a healthy person, is then prepared in dilution to treat those symptoms in someone unwell.
mm,
And although it's a very complicated system that I've studied for years, a very simplistic example would be looking at poison ivy and the symptoms that it causes, which is very similar to the symptoms of chickenpox, the rashes, the lesions, the itching. So if someone had chickenpox, we might get in of poison ivy, and it would facilitate healing. So I have used it and I've seen people come through it very quickly. I've also used it on shingles, which is a similar type of presentation.
mm,
So we're looking at the presentation versus the diagnosis or the disease. Another simple example would be, we know for some people peeling an onion causes watery eyes and irritation. And that is often used in remedies if someone has allergies because they have watery, irritated eyes. So that's the simplistic analogy of homeopathy, how it's used as first aid or acutely. But it becomes much more complicated if we're treating the totality of the person, or someone who has a chronic disease, say
mm,
someone who has an autoimmune disease, Crohn's disease, or multiple sclerosis, or they have a psychological problem, they're schizophrenic or bipolar.
Mm.
So these are more extreme conditions that can be treated with homeopathy when you're looking at the constitution, which is one of my specialties. So of course I do acute care. Somebody comes in, I can give them a remedy, they're going to feel a lot better. And usually it works quickly. But if they have a condition they've had for many, many years, then it's a different kind of situation.
Mm. Yeah, that makes a lot of sense. Yep. Yeah. So I also understand that Bach remedies are considered similar to homeopathy, and that might be something that even less people have heard about. Can you explain a little bit about that?
Yeah, so the Bach remedies are similar in that they work on an energetic premise like homeopathy, and they are prepared from flower essences versus homeopathy, which can also be mineral, like sodium chloride salt, or animal, like um, the venom of a bee. Um, so the Bach remedies are prepared from flower essences, and although they can treat physical symptoms, they are often more used for emotional, psychological balancing. Um, and they are also prepared in dilution. The form that they are taken in is often drops under the tongue of the dilution. I would say it's a very gentle remedy, but very powerful. And when I first started studying and using them, I also was skeptical. Do they work? You know,
Mm.
how much should I charge for them? I practically gave them away. And then I saw the power of the remedy. Patients that maybe they were well from their physical conditions, but they kept wanting to reorder their Bach, and they said it helped them.
Mm.
And even my staff would notice, what did you give to this person? They're so much lighter. Their face has changed. They're happier. Um, and I'm not proclaiming that it's some kind of drug, but I think it because when we can balance energy, you open up the blockages so that the person can become who they are at their core. We're not
Mhm.
changing that. We're just
Mm.
allowing them to be who they are.
Mhm.
And um, oftentimes, if I feel I'm working with someone physically, but I feel there's a blocked, maybe it's a belief system, maybe it's a trauma they held on to, that the Bach remedy can be used to open up the case. And now everything else can work better, including their psychotherapy.
Mhm. That makes so much sense. It's just a gateway to deeper healing, really, on all levels. So, yeah, I love that. That's beautiful. Um, what kind of patients seek homeopathic care in general?
So it is a variety. Some patients, they've experienced homeopathy and they may call that specifically what they want because it worked for them in the past.
Mm.
But also maybe it's 20 years later and their health is not the same as it was 20 years before.
Mhm.
And that may be a patient where homeopathy is a great idea, but you also want to do the testing. You want to find out what conditions do they have now? Are they pre-diabetic? Do they have high cholesterol? And those things may be more addressed better from a naturopathic or functional medicine point of view. Um, Other cases, I may see a patient where they come in for naturopathic care or general care, and where I may observe there's a strong emotional, psychological component. They may even tell me that. Um, Again, I would feel homeopathy can then open them up to every other modality I may use. So, for example, if someone comes in with high blood pressure, but there's a stress component, and that's the underlying cause, then we want to address the stress. And there's many ways to do that: biofeedback, psychotherapy, um, cognitive behavioral therapy, acupuncture. but homeopathy may be the one thing that either diminishes the anxiety or eliminates it to the degree that they can now be more responsive to other therapies, and their blood pressure is not a big component because their
Mm,
blood pressure was really a stress issue, not a blood pressure issue. So conventionally, they may have been given blood pressure drugs. And if it's very high, they may need it. They may need crisis intervention. But if it's not too high, then we would look at natural therapeutics and homeopathy. Other cases where I think it's a beautiful system of medicine is with children, because with children, you don't want to do too much herbs or things they have to take by mouth. Um, and they don't have a big history of a lot of environmental stuff thrown on them.
mhm.
So they respond very well. And it's very easy to take because it's just the little white sugar type pellets under the tongue, and they're happy to take them. It's not a terrible tasting herb. I think of a case, a dramatic case, a young girl, maybe 4 years old, came into my office with severe anger tendencies. And in the office with her mother and grandmother, she was beating up on her grandmother, hitting her, punching her, yelling, screaming for no known cause.
Mm.
I took her case and gave the remedy. And maybe months later, the grandmother came in for herself and said, I don't know what you gave this child, but that is gone. She's a happy little girl. So that's a dramatic case. I'm not saying they're all
Wow.
dramatic,
Sure.
but it's more dramatic with the children than the adults. Because if an adult has a 20, 30-year history, there's a lot of environmental, emotional trauma stuff that you have to work through. And they may go through several remedies, each one peeling away the layer till they get to the next level that you can address. But with children, it's much easier. And homeopathy is also used in veterinarian medicine. So we could say there's no placebo effect because you can't tell the
Mhm.
dog they're going to get better.
Right.
And I have helped patients with their pets just because I knew I couldn't, I wanted to.
Right.
And we would see either changes in their behavior or their physical conditions. So I would say homeopathy, as we know from history, it may have been used as the only system of medicine, together with maybe nutrition, exercise, good lifestyle.
Mhm.
I think today it's different because our life is different. So we
Right.
have many more stresses, we have many more environmental toxins that have an effect that we may do testing on, toxic metals, infections, things like that. So it doesn't, I feel it doesn't work today like it did, 100 years ago because life is more complicated.
Mhm.
But when you combine it with other systems of medicine, functional medicine, looking at improving nutrition, looking at how botanicals can strengthen the adrenal glands from stress. And then you add homeopathy, it's like a winning combination.
Mm. So much synergy there. Yeah, that's compelling. Sounds amazing. So, yeah, especially for the children. Children and pets, I find they're very honest and transparent. So, it's not complicated. They don't complicate things. So,
Yes.
just curious, any side effects or contraindications? Like, are there populations who maybe should not use homeopathy or Bach flowers?
That's a great question. Um, Homeopathy is not known to have side effects. And part of the reason is it's not working on a chemical basis like an herb. I mean, most herbs are safe, but some are toxic and overdose. And if the patient self-medicated, they can have a toxic liver, just like a drug.
Mhm.
But homeopathy, it's prepared in dilution to the degree that if you studied it in the laboratory, you would say, there's nothing here. There's no chemical here. And
Mm.
that's because it's working on an energetic premise. Um, And that's why it's beautiful for children, even infants. So even an infant can take it.
Wow.
And that is also why there's no contraindications with prescribed medications, because it's not chemical and chemical, it's chemical and energetic to stimulate the body's own. Homeopathy can be misused in the hands of someone who doesn't know homeopathy. So the energy may be overstimulated or pushed too much in a direction, and then we may see a temporary aggravation of symptoms.
Hmm.
So people who self-medicate, maybe they read a book and they start buying a whole bunch of remedies. We would say they complicate the case, like they dirty the case.
Hmm.
Not that I would say I'd see anything awful happen, but it could confuse the case. And that's one of the reasons when I work with someone, I start with the gentle, low dose, see how they respond. I almost never see an aggravation. And then we see if it's working. It's working, but they plateau. Like it's working and then they stop. Then I will go to a higher dilution to work a little bit deeper. So again, the gentleness is at the level that we could treat an infant. And even if that infant were sick and on drugs or medications, we could still use it.
It's just so fascinating to me. I love it. I love this conversation. I love the element of this bio-individuality, not a one size fits all approach, and just really looking to synergize different forms of medicine that don't that do no harm. I love that philosophy, and I use that myself. So I appreciate it so much. Yeah, if
Thank
people
you.
want to find out more information about how to book an appointment with you, can they just book an a la carte appointment with you for homeopathy, or do they need to be a patient of yours?
Absolutely.
Okay.
So absolutely, some people they call, they just want homeopathy. They had it
Mhm.
before. But I always give my honest overview of, okay, you have this condition or that condition, and maybe it's a good idea to address things on a physical level, not just energetic.
Mm.
But some people, because of their history, I will absolutely do that. They know they can contact me through Block 134. They can also see more about my bio on healthprofs.com. They can call and leave a message, send me an email, and then I always recommend, even if they don't want it, a free consult over the phone or video so they can tell me more about their history and their condition, and I can give them an overview how I may address it. Or if it's a case where I'd say, okay, I'll start with homeopathy, but I think we need to dig further and look at laboratory work and
Mm.
see if there's some things preventing or blocking the energetic therapeutics.
Mm. That's great. Yeah, we'll put all of Irene's contact information in the show notes so that people can get a hold of you however they would like. Yeah, I really encourage people to look into this more. I know I am. I am really interested in this as a practitioner and a patient. So thank you so much for your time and for
Thank
sharing
you.
your knowledge with us and your expertise. It's so much appreciated. And again, you can find Irene on block134.com in our directory. And we look forward to having more of these conversations. We'll be offering webinars online and some workshops in person at Block 134 in downtown Putnam. And I'm just hoping to get some resources out to the community and some education about different types of medicine and holistic well-being. So thank you so much.
Thank you.